फाइनली और मेरे हैंड्स को ऑन करने की सुनो। तो गाइस हम बकाया वकाज़े की इंटरव्यू स्टार्ट करते हैं. Hello Perplex team. My first question is what is the Pomodoro technique and who invested it?
The exact location of the placenta can vary from person to person. Generally, it attaches to the uterine wall and it can be on the front, back, top, or sides. Most commonly, it's either anterior, which means on the front wall of the uterus, or posterior, which is on the back wall.
Okay, Perplex team. My next question is why is each Pomodoro session typically 25 minutes long?
At 25 weeks of pregnancy, the placenta is usually well developed and attached to the uterine wall. The location should be stable by this time in most cases. If it's anterior, posterior, or fundal, on the top part of the uterus, that's typically normal. However, your doctor can confirm the exact position through an ultrasound. If there's any concern like placenta previa, where the placenta covers the cervix, that's something your doctor would keep an eye on. Usually by 25 weeks, the placenta position is quite clear.
Okay, Perplex team. My next question is how do taking breaks improve productivity?
Yes, the placenta can move as the uterus expands. Early in pregnancy, it might be lower, but as the uterus grows, the placenta often moves upward. By the third trimester, its position is usually stable. If it was low-lying earlier, it often shifts away from the cervix as the uterus expands. However, your doctor will monitor it with ultrasounds to ensure everything is in a safe position for delivery.
Okay, Perplex team. My next question is what are the psychological benefits of using the Pomodoro technique is?
Using a Doppler ultrasound during pregnancy has several benefits. It helps measure the blood flow in the umbilical cord, placenta, and baby's blood vessels. This can give doctors more detailed information about the baby's health, especially if there are concerns about growth or oxygen supply. It's often used if there's a high-risk pregnancy to check on conditions like preeclampsia or fetal growth restriction. Overall, it provides a clearer picture of the baby's well-being.
Okay, Perplex team. My next question is how many Pomodoros are recommended is a single work day?
The number of ultrasounds recommended during pregnancy can vary depending on your health and your doctor's approach. For a normal, low-risk single pregnancy, usually 2 ultrasounds are standard. One in the first trimester, often around 8 to 12 weeks, to confirm the pregnancy and check the due date. The second is around 18 to 22 weeks, to check the baby's anatomy and development. If everything is normal, that's usually enough, but more can be recommended if needed.
Okay, Perplex team. My next question is what kind of tasks are best suited for Pomodoro sessions?
For early pregnancy ultrasounds, a transvaginal ultrasound is often the best because it provides a clearer image when the baby is still very small. As the pregnancy progresses, abdominal ultrasounds become more effective and comfortable for the mother. By the second trimester, an abdominal ultrasound is typically the standard method and is well suited for monitoring the baby's growth and the placenta's position.
Okay, Perplex team. My next question is how can the Pomodoro technique help with procrastination?
Doppler ultrasound can help measure the blood flow in the placenta, uterus, and the baby. This helps doctors see if the placenta is providing enough oxygen and nutrients to the baby. It's especially useful if there are concerns about the baby's growth or if the placenta might not be functioning well. By monitoring blood flow, doctors can make better decisions about the timing of delivery or if any interventions are needed to support the baby's health.
Okay, so Perplex team. My next question is what tools or apps can be used to practice in Pomodoro technique effectively?
Transvaginal and abdominal ultrasounds are both safe during pregnancy. They use sound waves, not radiation, so they don't harm the baby. Doppler ultrasound, which checks blood flow, is also considered safe when used appropriately by professionals. The energy levels are low, and the focus is on brief, necessary scans. As long as ultrasounds are done by trained medical staff, they're a valuable and safe tool throughout pregnancy.
Okay, perplexity. My next question is, how do short breaks help your brain rest and refocus?
Yes, sometimes the placenta can move upward naturally as the uterus grows. This is especially common if it's low-lying earlier in pregnancy. As the uterus expands, the placenta often moves upward, away from the cervix. This can reduce the risk of complications like placenta previa. By the third trimester, the placenta is usually in its final position. If it's still low near the end of pregnancy, that's when doctors might monitor more closely to decide the safest delivery method.
Okay, perplexity. My next question, can the Pomodoro technique be modified to fit longer or shorter acting spans?
Doppler ultrasounds are usually pretty quick. The length depends on what your doctor is checking, but typically it's just a few minutes longer than a standard ultrasound scan. If they need detailed measurements or have concerns about blood flow, it might add a few more minutes. But overall, it's still a quick and efficient procedure.
Okay, perplexity. My next question is, how do you track your completed Pomodoros throughout the day?
Usually, the placenta is fully formed by around 12 weeks of pregnancy. However, it continues to grow and develop throughout the pregnancy. By the end of the first trimester, it's well established and fully functioning to provide nutrients and oxygen to the baby throughout the rest of the pregnancy.
Okay, perplexity. My next question is, what's the ideal length of
The
a
ideal
long break after completing 4 Pomodoros?
after a full-term pregnancy, the ideal recovery period can vary from person to person, but generally doctors recommend about 6 weeks. This gives the body time to heal and the uterus to return to its normal size. Of course, if there were complications or a C-section, recovery might take a little longer. It's important to listen to your body and follow your doctor's guidance during this time.
Okay, Pomodoro. My next question is, how can students use Pomodoro for exam preparation?
Ultrasound is generally not used as a primary method for contraception or abortion. It's mainly a diagnostic tool to check on the health and development of the pregnancy. For contraception, other methods like birth control pills, IUDs, or condoms are used. In cases of abortion, ultrasound might be used to confirm the pregnancy stage, but it's not a tool for the procedure itself. Always consult a healthcare provider for the right method based on your needs.
Okay, perplexity. My next question, can teams or groups use the Pomodoro technique collaboratively?
There's no solid evidence that ultrasound causes infertility. Ultrasounds use sound waves, not radiation, so they're considered very safe. They've been used for decades in pregnancy care, and there's no known link to infertility or long-term reproductive issues. Always follow your doctor's advice, but ultrasound is widely trusted in medical practice.
Okay, so Pomodoro. My next question is, how does the Pomodoro technique reduce mental fatigue?
There isn't strong evidence that Doppler ultrasound used in pregnancy affects mental health later on. Doppler ultrasound is a non-invasive tool that checks blood flow and is considered safe when used by medical professionals in pregnancy. The goal is always to monitor the baby's well-being and support a healthy pregnancy, which can actually reduce stress for parents by providing more information. Always talk to your doctor if you have concerns, but it's a well-established, safe technology.
Okay, but plus team, my next question is, what are some common mistakes people make when starting to motor?
Some common mistakes during an ultrasound might include misinterpreting the images if the technician isn't experienced. Sometimes, the baby's position or movement can make it hard to get clear images. Also, if the ultrasound is done too early or too late in the pregnancy, it might miss important details. That's why it's important to have ultrasounds at the recommended times and with qualified professionals. That helps ensure you get the most accurate and helpful information.
Okay, so perplexity. My next question is, how can you stay disciplined during a motor session, explaining with distraction?
Staying calm and relaxed during an ultrasound can definitely help. When you're relaxed, your body is more at ease, which can make it easier for the technician to get clear images. If you're tensed, it might be a bit harder for them to move the probe around comfortably. So taking slow, deep breaths and staying calm can make the whole process smoother and more comfortable for you and the technician.
Okay, motor. My next question is the promoter. Okay, perplexity. My next question is, the promoter technique effective for creative tasks like writing or design?
Yes, the Doppler ultrasound technique can detect the baby's heartbeat by measuring blood flow through the heart and vessels. It's often used when you can't hear the heartbeat through a regular ultrasound yet. It can also pick up the sound of blood flow in the placenta or umbilical cord. The gentle pulsing or whooshing sound you hear during a Doppler scan is the sound of blood moving, so it's a great tool for monitoring the baby's heart rate and overall circulation.
Okay, perplexity. My next question is, how do you adjust the promoter technique for different types of workloads?
Doppler ultrasound settings can be adjusted to focus on different parts of the body. The frequency and angle of the ultrasound waves can be changed depending on whether the doctor is looking at the baby's heart, umbilical cord, or placenta. For example, if they're checking blood flow in the umbilical cord, they'll adjust the settings to get a clearer picture of that specific area. Adjusting the settings helps get the most accurate information depending on what the doctor needs to examine carefully.
Promoter. My next question is, what's the difference between deep work and promoter-based productivity?
Sure. Color Doppler shows blood flow in a two-dimensional image, using colors to represent the direction and speed of the blood flow. It gives a broad view, showing where blood is moving and in what direction. On the other hand, Power Doppler is more sensitive and can detect slower blood flow that might not show up on Color Doppler. It doesn't show the direction of flow as clearly, but it's really good for picking up tiny or slower vessels. Both are useful in different situations, depending on what the doctor needs to examine.
Okay, my next question is, can the promoter technique help improve work-life balance?
Doppler ultrasound is very safe when used appropriately by trained professionals. It uses sound waves, not radiation, and is carefully regulated to avoid any harm to the baby or mother. The energy levels are kept low, and the scans are usually brief to minimize exposure. It's a standard tool in prenatal care and has been used safely for many years. Just always follow your doctor's recommendations.
Okay, next theme and explain how do encryption affect the promoter technique and how can you manage them?
Doppler ultrasound works by sending high-frequency sound waves into the body. When these waves hit moving blood cells, they at different frequencies, depending on the speed and direction of the blood flow. The ultrasound machine picks up these changes and translates them into visual or sound information. This helps doctors see how blood is moving through the placenta, umbilical cord, or baby's heart. It's a quick, non-invasive way to get important information about blood flow and circulation during pregnancy.
Okay, perplexity minus question. How can you combine Pomodoro with other productivity methods like time blocking?
Yes, Doppler ultrasound can be combined with other ultrasound techniques, like 3D imaging. While Doppler focuses on blood flow, 3D ultrasound provides detailed images of the baby's structure. Combining them can give a fuller picture of both the baby's development and the blood flow, providing even more information to doctors for a comprehensive assessment.
Okay, perplexity minus question is Pomodoro effective for people with ADHD or contraction difficulties?
There's no scientific evidence that Doppler ultrasound causes ADHD, autism, or speech delays. It's a widely used, safe technology in prenatal care, and studies so far have not shown any direct link between its use and developmental issues. Doctors use it with care to ensure the baby's health, and it's considered a safe procedure. If you have any concerns, it's always good to discuss them with your healthcare provider.
Okay, perplexity my next question is how does the sense of energy during a Pomodoro improve focus?
The sound energy used in a Doppler ultrasound is very low and carefully controlled. It's not intense enough to cause any damage to tissues or cells. The process is non-invasive and has been used safely for many years. The levels of energy are much lower than what would be needed to cause any harm, so that's why it's considered a safe procedure for both the mother and baby.
Perplexity my next question is what's the best way to transition from a break back into focused work?
The best position for a Doppler ultrasound usually depends on what the doctor is examining. But for pregnancy, the most common position is lying on your back with your abdomen exposed. This gives the technician easy access to move the probe and get clear images or sound. Sometimes they might ask you to tilt slightly or shift positions if they need a better view, but comfort and clarity are key.
Okay, perplexity my next question is can the Pomodoro technique help with burnout prevention?
Doppler ultrasound is mainly a diagnostic tool, not a preventive measure. It helps doctors monitor blood flow and detect any issues early, which can lead to better decisions and care during pregnancy. By identifying potential problems with blood flow, doctors can take steps to manage conditions like preeclampsia or fetal growth issues. So while it doesn't directly prevent problems, it plays a crucial role in early detection and management, which can improve outcomes.
Okay, so perplexity my next question is how do you reflect on and improve your Pomodoro session over time?
A Doppler ultrasound appointment is usually pretty straightforward and doesn't require much special preparation. It's a good idea to wear loose, comfortable clothing so the technician can easily access the area they're scanning, usually your abdomen during pregnancy. You might be asked to drink water before the appointment if they need a full bladder. Otherwise, you can eat and drink normally. It's a non-invasive, painless procedure, so there's not much to worry about in terms of preparation. Just follow any specific instructions from your doctor.
Okay, right, okay, perplexity. My next question, what should you do during your 5 minute break to stay energized?
Sure. So, Doppler ultrasound is a safe, non invasive tool doctors use during pregnancy to check blood flow and the baby's heartbeat. It helps ensure the baby is getting enough oxygen and nutrients. You don't need to worry about radiation because it uses sound waves, not X rays. It's a quick and painless procedure, often done during routine checkups if the doctor wants more information on the baby's health. Just relax, and it'll be over quickle. That's pretty much it in a nutshell.
Okay, perplexity. My next question is how can you motivate yourself to stay consistent with the Pomodoro technique?
Doppler ultrasound doesn't directly measure the baby's oxygen or nutrient levels in the blood. Instead, it measures how blood is flowing.
Okay, perplexity. My time is over. Bye, perplexity. Bye, everyone.